Hi, everyone, and welcome to the first ever VN Live event. Today, we're going to be talking about sex after menopause, and we'd like to thank our sponsor, Pfizer, for making this all possible. I'm Beth Blakely, and I'll be your moderator today. And I'd also like to introduce Jessica Maleo. She's going to be doing a little technology for us today. We've got some exciting door prizes to give away, so I'd like to invite you to register as an attendee below the video pane and ask any questions that you have. We've gotten lots of questions in before the event began, and we'll try to get to yours, but even if we don't get to it during the live broadcast, we'll make sure that you get an answer. So the first thing I want to do is introduce you to our medical expert, Dr. Barb DePree.
Hey, Beth.
Dr. DePree has been a women's health provider for more than 25 years and a menopause care specialist for the past 7. She's a Vibrant Nation blogger and founder of MiddlesexMD.com, a women's sexual health site. She was named the 2013 Certified Menopause Practitioner of the Year by the North American Menopause Society for exceptional contributions to menopause care. Thanks for joining us today, Dr. Barb. Can you tell us a little about your experience helping women through menopause?
So for the last 7 or 8 years, my practice has been focused primarily on menopausal women's health.
Dr. Barb, I don't think your microphone's on.
Can you hear me now?
I can hear you.
Can you hear me?
Well,
can you hear me now?
1 second.
Beth?
Oh, I know why we can't hear, everyone else can.
We can't?
I can't.
Because you turned your sound off.
Is yours not on?
No.
Oh.
Okay.
Are you?
So I'm feeling a little like Carol Burnett right now because we're on live, and sometimes these things happen. Dr. Barb, it was our mistake, not yours.
Can you hear me now, Beth?
Yes.
Okay. Great. So let me just tell you a little bit about my practice and my background in healthcare. For the last 7 or 8 years, I've been taking care of menopausal women's health. So I focus on the group of women primarily over the age of 40 for a variety of health related problems, but mostly related to perimenopause and menopause. So of course, pain with intercourse is one of the problems that comes up commonly. So this is a topic that I talk about with women every day in my practice. I'm just excited that we've got a bigger audience to engage in this conversation today, and hope that women will benefit from hearing more about this condition.
Well, I definitely think that's true. Your mic, your sound off, my sound on.
That's why I haven't turned this.
Okay, so next I want to introduce our 3 panelists. First, we have Allie Smith, a blogger, wife, mom, and grandmother. Her passions are writing, reading, cooking, and planning parties. And she shares it all with a healthy dose of laughter at anallieevent.com.
It's good to be here.
Great. And next up, we have Lisa Copeland, a dating coach who specializes in helping women over 50 make great love connections. Mm-hmm. She shares her advice on her blog, findaqualityman.com.
Hi, Beth.
Hi. Last but not least, we have Rebecca Forstott-Olkowski. She's the founder of babyboomster.com, a food, wellness, lifestyle, and travel blog. And she also hosts a podcast called Two Boomer Broads, Life, Love, Laughs, and Unsolicited Advice, available on iTunes. And these women,
Thank you.
Hi. These women have so graciously agreed to come and tell the whole truth, their personal stories, in hopes that it will help other women and answer your questions. And speaking of questions, I want to remind you that this is an interactive event, so please do log in as an attendee and join the conversation by submitting your questions below. We will not share your identity with anyone, and your secrets are safe with us, so please feel free to do that. Before we jump into your questions, though, Dr. Barb, can you please help us understand what is menopause and what are some of the associated symptoms?
So the true definition of menopause is the absence of periods, and we add the definition of 12 months with the absence of periods to really define a woman to be in menopause. Leading up to that, a woman is considered perimenopausal for maybe even years. So menopause is heralded by the stop of periods, but really the reason for that is the failure of the ovaries to continue to produce hormones, specifically estrogen and progesterone. I explain to women that you have estrogen receptors in your brain, your skin, your bones, your breasts, your blood vessels, your vagina, your vulva. So the absence of estrogen can begin to have its ramifications throughout your body in many, many areas. Therefore, it might be hot flashes that you're experiencing. It might be sleep disruption. It might be mood disorder. It might be more dry skin. So the symptoms related to menopause can be very varied from woman to woman. Some women may transition through menopause without any symptoms at all. About 6,000 United States women experience menopause on a daily basis. So with baby boomers now over the age of 50, there are many, many of us who are now in menopause. So our goal is really to try to help understand what the best way to manage postmenopausal women is so we can improve their quality of life. One of the biggest consequences of becoming menopause is going to be the absence of estrogen to the vagina and vulva, and that's really why we're here today, to talk about what that means, what women might experience as a result of that, and maybe some treatment options that will help improve their quality of life related to their sexual health.
Great. Thank you so much. And it sounds like what you're saying is we are not alone, and that is so comforting. And so speaking of not being alone, we have a question from Mrs. R. And she says, I have had my hormones checked and they say they are still normal, but I can't even fantasize anymore. Orgasms are getting difficult to come by, even with a vibrator. What can I do? Similarly, Barbara from Orlando asks, it seems like a vicious cycle of lowered libido and pain during intercourse. The pain lessens my desire to try it again, and the lack of sex then causes more vaginal atrophy and even lower libido. Sometimes I feel as though I could live the rest of my life and not miss sex. What can I do to get my libido back? Now, Allie, I know you had a friend go through something similar. Is that right?
That's correct. Matter of fact, a few days ago, my friend, and the thing about it is she was embarrassed to even talk to me about it because we always feel like we're the only one going through it. But I could tell she was really nervous, but she approached me and she said, I'm entering my early stages of menopause because she's a little bit younger than me. And she said, I'm surprised at how quickly my sexual drive has diminished and how quickly the pain has increased. And she said because of the pain, it causes her to tense up. And because of the tension, it makes everything worse. It makes the pain worse. And then she doesn't want to have sex at all. And, of course, her husband, is all crazy, and he can't understand that. And, I've taught many marriage seminars over the years, and I've noticed that even with my teaching that sex after menopause is a subject that's completely neglected. I've never talked about it, and none of my friends. I've never heard, and some of us are too embarrassed to talk to our doctors about it. I'm so glad it's being brought to the forefront today.
Yes, as am I. And Lisa, what do you hear from your clients on this issue?
Well, one of the things I hear is that a lot of women want sex, and it's a very high priority when they haven't had sex. But once the sex, the initial high and the initial hormone boost goes, they're finding that the priority starts dropping. In fact, one client told me her boyfriend really wanted to have sex. She was reading a book, and he came up, and he put her hand on his crotch, and she said, "Not now, honey." A lot of women, my friends and I have talked about it, that sex has become a lower priority, that a lot of them feel like they're looking up at the ceiling and they are thinking about their grocery list or what's on their calendar tomorrow, and it's frustrating for many of them because they don't know what to do to change this.
Yeah. So, Rebecca, how is your libido these days?
Well, I'm 61 years old, and I actually had a pretty lively sex life, especially during the 70s, like a lot of us did, at least in my age group. And right now, I'm with a partner who I had a really great relationship with sexually, but now he's, experiencing ET, like Bob Dole, whatever. And so he's pretty much given up on it. And so I'm really worried about the vaginal atrophy that could happen from, not doing it for a extended amount of time.
Right. So, Dr. Barb, it sounds like this is not unusual for women during menopause. Is that the case?
Right. So you've all touched on a really big topic here, one that we could spend an hour talking about that alone. And so let's start out talking a little bit about libido, which is really complicated. I have a graph I show women. It's actually a pie chart that is cut into about 8 different sections, and each section has a couple of bullet points, and they're all factors that may relate to libido. So all of them may diminish libido. So that unfortunate truth is for many women, certainly not all, but for many women, they experience a decline in their libido. Probably it's a natural process of aging. We see it in a natural process of a long-term relationship. And there are other factors like medication, fatigue, stress, privacy. Probably at the bottom of that pyramid of importance for libido is going to be a relationship. And so I often try to start there and say, are you in an emotionally supportive relationship? Is your husband, partner completely emotionally supportive? Because when that's not present, there's not much I can do to help that relationship. But assuming that's there, women grieve this. They're really sad that they're no longer as interested. And partners start to question whether they're really loved or found attractive. So it becomes this negative dynamic. And then if you add pain into this equation, it's really a disaster. So with a declining interest and increasing pain, we know that that's going to likely lead to more difficulty in the sexual relationship of a couple. So first, addressing pain is going to be important, but then having a frank discussion with your partner. There's been some interesting research around this topic, and what we find is that women lose their innate drive to have sex. On the other hand, once they choose to engage in sex and are in the act of having sex, they're very motivated to stay in, and they find it enjoyable or able to arouse an orgasm. So for a lot of women, it's a matter of being more mindful and intentional around sex, setting aside the time. You talked about the grocery list. I tell women, have your last load of clothes in the dryer folded, your couple emails returned, your grocery list completed. So you kind of need a clean slate for women to allow their minds to fully engage. So it takes a little bit more planning. The spontaneity that we once enjoyed probably is going to be less likely to happen. So being intentional and mindful around sex is going to be helpful. It's also a time a sex therapist can be really helpful to couples too, to try to be another voice to help each individual understand where the other is coming from, because there can sometimes be some impasse in dialogue around this topic.
Great, thank you. That is such great information. And now one of my favorite times, we get to draw for our door prize. The first prize that we have is coming from Dr. Barb, and it's a personal lubricant selection kit. So what you'll get is a selection of different lubes to try in sample format, so you can find the one that works the best for you, because as we know, some are too sticky, some are too thick, some are too juicy, for lack of a better word. So this kit is really great for women who are looking for that perfect lubricant. And our winner is Renee. So Renee, look for an email from vibrantnation.com about how to get your personal lubricant selection kit. So that brings us to our next question, and it comes from Silver Sadie. And she says, since menopause, intercourse is very uncomfortable and even painful at times, which leads me to then avoid sex with my husband altogether. I use vaginal estradiol 3 times a week, plus an estradiol patch twice per week. I'm very hesitant to use lubricants as they cause me yeast infections, which I then pass to my husband. Please help. So, Lisa, what's your experience with using lubes?
It's when women are first starting to have sex in my practice again, first of all, I always say check with your doctor what you want to do, but we do talk about lubrication. And you mentioned, Beth, one of the side effects of lubrication being the stickiness and having to apply it again and again. But the good part about lubrication, it has definitely made it easier for women to have sex, both outside the genital area and inside, it seems. So the other thing that people have told me about is the more that they have sex, sometimes that lubrication starts to come back. And maybe Dr. Barb can also talk about that too, if that is true. Use it or lose it.
Yes, please. Dr. Barb, can you explain a little bit about where the pain is coming from?
And you make a great point, and I'm glad that this was brought up early in the discussion, because one of the treatments for vaginal dryness is to engage in intercourse more regularly. And if you don't have a partner, incorporating a vibrator or a dildo can provide that, because what happens during the event of sex is that it brings more blood supply to the genitals. So what's happening in the perimenopausal time, maybe postpartum, maybe certain medications, is there's less circulating estradiol, and because of the abundance of receptors in that area, the elasticity and moisture is declining. Over time, that's going to be progressive. So early on, it's noted as dryness. When there's entry, there's more friction, discomfort. So usually it's upon entry that women are first going to note that. It may be uncomfortable for your partner as a result of that too. So that's when grabbing a lubricant is going to be helpful. I did an article on this for a journal a year or two ago, and I went to my local Walgreens, and there were 38 different vaginal lubricants on the shelf at Walgreens. I then went to a Rite Aid, which happened to be in my neighborhood, and there were 14 products there. So part of the difficulty is just navigating this arena of selecting a product. They are water-based, they're hybrid, they're silicone, they vary. They have other additive flavors, for instance, warming or arousal features. And every individual is somewhat sensitive, maybe one from another. So that's where Middlesex MD, we put together a lubricant selection kit, so you can try 7 lubricants in a small size and then determine which one is best for you and your partner. And I typically have a selection in my practice where I have women feel them in their hands so they can understand how the characteristics differ from one category to another. Usually starting with something simple and without a flavor and without arousal is a good idea, because when tissues get to be a little bit more sensitive and dry, some of those things can be irritating and uncomfortable.
Okay, great. You know, these conversations can be so difficult, and I'm so glad that you're a doctor who is open to having that conversation. And we certainly want to encourage everyone who may be having some symptoms that make sex after menopause difficult to go ahead and talk to your doctor, because there are solutions and you can enjoy sex. So let's go on to question number 3. This comes from Mrs. T from Carolina. And she says, I don't experience pain during intercourse. However, my husband told me that my vagina does not feel the same. He says that it is too tight and dry, which causes him discomfort. There are also times when I do feel my pH is off. Any suggestions on how I can regain my past elasticity, as well as any ideas for keeping a balanced pH? Now, Rebecca, do you have a story about this?
I've always been concerned with the pH, and also, you know, I thought it was kind of interesting about how he felt about, you know, being in there and having it not feel the same way that it used to, because sometimes you even feel like your uterus is kind of like sticking out, you know, making it uncomfortable as well. But I was also wondering about the pH and what you can do to keep your pH at a normal level, if there's foods you can eat or other things. I guess, you know, with the lubes as well, lubes are definitely your friend. I thought it was really funny. One time I went to a baby boomer event, and in our swag bags, it was like a convention. They actually gave us some lube in the swag bags. I thought that was pretty funny.
That is a pretty
It had an estrogen in it. I wasn't sure what to do with it.
great. Okay, so Dr. Barb, can you shed a little light on this issue about the pH in the lube?
Sure. So pH is something most of us aren't necessarily acutely aware of until it becomes disrupted. So it's pretty amazing that your vagina has just been behaving itself for 30, 40 years, and then in the absence of estrogen, everything changes regarding the vulva and the vagina. And it's in the absence of estrogen that the pH goes from acidic to alkaline. So the pH actually rises in the absence of estrogen. And as a result of that, the bacterial milieu will begin to change. So we all have normal natural bacteria in our vagina that is healthy, that's required to be there. And that will begin to shift as the pH changes. And with that shift, some women may become more susceptible to infections or other symptoms. The other thing that estrogen is doing is it's providing elasticity to the vagina. My colleague Jim Simon uses the analogy of a pleated skirt. So when we have a fully estrogenized, healthy vagina, the vagina is a bit like a pleated skirt. It's got lots of room, it can stretch, you can pull and move it, and it's comfortable. And then I would use the pencil skirt analogy for the postmenopausal vagina, where it becomes more narrow and thin, and anytime it's tried to stretch, there's probably going to be some discomfort associated with it. So the perception that your partner is noticing a change probably is related to some of the elasticity that's changed as a result of now being menopausal. But there's another condition called vaginismus, and that has to do with pelvic floor muscles and the tension in pelvic floor muscles. It's somewhat a response to painful intercourse that you don't necessarily intentionally change that muscle tone, but your body adjusts to the discomfort by doing that. And sometimes it will be described as men will say there's not enough room in there, or it feels like I'm hitting up against something. And that's where a really good pelvic exam is important. So again, I would encourage you to talk with your provider about the symptoms you're experiencing, describing the pain. Is it near the opening? Is it when he's deep inside? Is the pain dry, scratchy? Is it burning, tearing, sandpaper-like? So there are many causes of what might be contributing to the pain with intercourse. It's not all atrophy, it's not all dryness, it's not all best treated with vaginal estrogen like Premarin vaginal cream, for instance. There can be other conditions that need to be appropriately treated to make sex more comfortable as well. So a good exam is really crucial to the proper treatment.
Absolutely. And I have to say I have a new appreciation for pleated skirts at this point. Okay. We have another question. This one comes from Joanne from Pennsylvania. And she says, I have not been intimate with my husband for about 6 months. I am 53 and have stopped menstruating about 4 months ago. Lubricants help, but sex is still painful. Are there any safe hormones or bioidentical hormones to relieve menopause symptoms such as painful intercourse? So Rebecca, remind me, what was that sample that you received at the event?
It was a lube that had some type of estrogen, I think, in it, and I wasn't really sure if I should use it or not.
Right.
You know.
So, Lisa, didn't you have a friend that had a different method of getting the estrogen into her body?
They did. She was experiencing terrible menopause symptoms in general. Besides lack of sex, she was extremely grouchy as the hormones were changing. She was extreme PMS, and she wasn't getting relief from anything. So she began to use pellets that get inserted into her hip. The only drawback seems to happen is the pellets are, as their effectiveness is going down, a lot of the menopausal symptoms show back up.
Mm-hmm. So, Dr. Barb, what's the scoop on these different methods of delivering estrogen?
So this is where we have a discussion with patients who are now menopausal about, so what symptoms are you having that are bothersome to you? And if it's around mood, it's sleep and night sweats, then we do want to consider systemic hormone therapy. And that may be some form of estrogen and or progesterone. You have a uterus, you also need to combine estrogen with a progesterone. And there are different ways of doing that: pill form, transdermal, pellets, a variety of options in treating those symptoms. And certainly non-hormonal options in treating symptoms too. And I don't want to ignore lifestyle and the benefits that a lifestyle will provide for women who are having menopausal symptoms. So talking to your provider, understanding what your own health history is, your family history for risks, and for most women, they are good candidates to consider hormone therapy. I remind women that for 35 or 40 years, every day your ovaries were making estrogen and progesterone, and they didn't bring harm to you. They were helpful to how you felt and functioned. So extending that by another 2 years or 10 years for most women is not going to add harm to them. But having that conversation with your provider is going to be helpful. And then for the women who more specifically are having sex-related issues, intercourse, pain with intercourse, we look at that as more localized therapy. So maybe system-wide, brain, blood vessels, skin, etc. doesn't need to be treated, but the vagina and vulva certainly does. And I also want to mention urinary tract. Some women will be having recurring bladder infections as a result of menopause and the absence of estrogen in this area. We've actually are renaming the term vulvovaginal atrophy. The new term is being applied to this is called genital urinary syndrome of menopause. So we want women and other providers to understand it's genitals, but it's urinary system as well, and it is a result of menopause. So because the cause is absence of estrogen, for many women, the treatment is going to be adding back estrogen to the vagina, so in that localized fashion. Farmer and vaginal cream has been around for many, many years. It's very effective for treating this. There's a cream called estrase cream. Vagifem is a vaginal tablet. Estrine is a vaginal ring, and now there's a non-estrogen oral option to treat it effectively as well called Esphena. So many options. Most women are candidates for this because we're not delivering the hormones throughout their system. We're only delivering it to those local tissues. And usually the benefits can be very remarkable.
I was wondering what a bioidentical hormone is. That's a term that a lot of people are talking about, and I have no clue what that is and why you would need that.
Actually, it's a marketing term. It's not a clinical term. We don't use that term really in our day-to-day practice because the only bioidentical estrogen is that which is being produced by your ovary. And we don't have another way of offering that to women. So every product that is being added back to you, no matter what the source, is being chemically created. Now, it can be made to look exactly like the estrogen coming from your ovary. So chemically, it resembles and looks like that. But the term bioidentical is really a misnomer. We would use the term biomimetic. It's mimicking the estrogen or progesterone or whatever hormone we're talking about. It's mimicking what the body is naturally producing, but it's not identical. It is not the very same.
Oh, okay.
Great. So now we have a door prize that will hopefully get you in the mood to have a little sex. We have a $100 gift certificate to Soma, and I'm happy to announce that Shelly, you are the winner of the $100 gift certificate to Soma. There is one more that's going to be given away, so if you haven't registered as an attendee yet, I encourage you to go ahead and add your name. We will not share your email address, and if you have any questions, please add those as well, and we'll make sure that you get an answer. So now we can move on to our next question. It comes from Carrie from Michigan, and she says, there are so many postings on social media about coconut oil and or prescription estrogen, and then you read about the horrible side effects you can get with estrogen. So my question is, if it's okay to use estrogen or coconut oils externally. So Dr. Barb, what would you say about that?
I agree that coconut oil has recently been widely used as a lubricant. We're trying to understand more about that in the clinical realm as to whether it is completely safe for women to use. My experience is that most patients do fine with coconut oil. On the other hand, in general, we have seen oils as maybe being a little bit occlusive to tissues. So if your skin is really thin and fragile and maybe sensitive, and you put an oil on it, that's going to be longer lasting and can macerate that skin a little bit. We've also seen oils in the vagina to be a a little bit disruptive to the normal bacterial milieu. And again, some women are just so much more sensitive to that than others. So it's, in general, oils have not been my favorite lubricant to recommend for women. But if you've used it and it hasn't caused adverse effects, I don't know that there's reason we'd say not to use it. So the idea of using a lubricant, that's really, it's treating the problem at that time, but it's really not preventing progression of the condition. So a lubricant and localized estrogen really are two very different ways of trying to address the problem. Early on, when there's discomfort, a lubricant's probably going to be somewhat beneficial. But in general, the statistic is 5 years into menopause, 50% of women are having some pain related to intercourse. And a lubricant is not going to resolve that at that point. It may make it less intense, but it's going to become more uncomfortable over time. That's really when, hopefully before it gets that uncomfortable, we're having the discussion to women about having or using a localized estrogen, if that makes sense for them. But back to use it or lose it. My few patients who are in their 70s, sexually active, not needing any kind of treatment for intercourse, are usually having sex fairly frequently. So the take-home message here is use it or lose it. Address symptoms before they become too difficult, because once they're progressed, it's sometimes hard to get back all of the function that was once lost.
Well, that brings us nicely to our next question, which is from Catherine in San Francisco. And she says, I have been very successful in managing postmenopausal symptoms during sex and have had wonderful, rewarding sex life. However, I'm currently without a partner. If I discontinue lubrication and stimulation of my vaginal tissues, will I be able to resume if and when I do find another partner, or is there some type of maintenance I should consider? And Rebecca, I know you told us that this was a similar situation to what you have going on. Can you talk a little bit about your experience?
Yeah, well, as I mentioned, I did have a pretty lively sex life. I was married for 23 years, and in 2001, my husband passed away. So I ended up reconnecting with somebody that I had met in the 70s again. And but the problem is he's also not in great health. He doesn't take care of himself. So I'm really kind of seeing the fact that it's possible that I could survive him as well, which would be sad, but I'd like to think that I could, be able to do it again, and have a sex life. So what could I do to, maintain that when I'm not actively having sex at the time, other than, well, probably playing with myself, I would imagine. But, yeah, are there things that you can do, exercises, anything like that?
Yes, so Dr. Barb, what is involved in this sexual maintenance that we need to do?
And this is an important topic because you're not alone. There are many women at this stage of life who are presently not in a relationship, and for a variety of reasons, but many of them hope to someday become sexually involved again. So ignoring it and assuming everything will be okay in 5 or 15 years is probably not going to work very well for you. So I do talk to women about, if you think you want to have intercourse again, whether it's sooner or later, they often don't know, I don't know. We need to think about what we can do to make that possible. So this is a good time to introduce the idea of vaginal moisturizers. We really haven't talked about moisturizers. Lubricants you bring out on Friday night when you're going to have sex and you want to make it more comfortable. But a moisturizer is a maintenance. So early in menopause, before the symptoms are more advanced, is a great time to introduce a moisturizer. And what that is, it's an intravaginal product, over-the-counter, non-hormonal, that you put in the vagina typically twice a week to try to maintain some of the moisture and elasticity so it's not going to progress day to day. So even those who aren't in relationships and those who are in a relationship can benefit from using a moisturizer to try to minimize the progression of the dryness. So that's something everybody can do pretty easily. Again, there's some variations in moisturizers. My website at Middlesex MD, we review some of the features of moisturizers. So that's a great option. But for most women, they're not aware that vaginal atrophy or genitourinary syndrome in menopause is occurring until they go to be involved sexually sometime later and are unpleasantly surprised to say, wow, it's really uncomfortable. There are a few women who will just have day-to-day symptoms of vulvovaginal atrophy, and it might be when I wipe, it's more uncomfortable. When I move about, it just feels more dry and chapped and irritated. And that may be an indication to begin treatment outside of the need for sexual activity, but just to be more comfortable. The majority of women, the symptoms are going to manifest themselves when they try to have sex. So again, we can't always get back everything that was once lost. So trying to be somewhat proactive, and in addition to moisturizers, vaginal estrogen, using a device or a toy, as you mentioned, is a great idea. So a vibrator, a dildo, but intravaginally, because we want to keep the capacity of the vagina intact. And just using something externally up against the clitoris isn't necessarily going to accomplish that, but an intravaginal vibrator or dildo is going to help accomplish that.
That's interesting. I didn't realize there was a difference between a lube and a moisturizer. Thanks.
You're welcome.
Great. So our next question comes from Carrie in Michigan. And she says, once you are dry, are you dried up forever? And similarly, Catherine in San Francisco asks, are these changes irreversible? And Allie, I know you said you have friends who are experiencing the dryness. Can you tell us what you hear from them?
Yes. Well, it's not my friends. I'm actually experiencing it too. So this is really helping me today, especially about the moisturizer. Now, I moisturize my face like crazy, trying to keep the, the lines and all that at bay. But I did not know that you could actually have a moisturizer for the other end. So that's great to have. Great to know. But I do have friends that we get together and we talk about the dryness and everything. And one of them told me the other day, she said it's like sandpaper. And, of course, then it leads to pain and then, again, a loss of desire. And so I'm just thankful today that we're finding out that there is things that we can do for the dryness. And like I said, I'm learning a lot of things today, too. So this is really helpful.
Great. Wonderful. So, Dr. Barb, can you talk about what's this dryness all about and how do we get to the Sahara Desert phase?
Right. We seem to keep coming back to our friend. I tell women, your best friend is estrogen in general, and especially to this area. It just has such remarkable effects to this area. I had one patient within the last number of months, we hadn't had intercourse for 6 years within her marriage, just had become too uncomfortable. Her family doctor had said, that's just what happens, kind of sorry about that. At age 63, she presented to me to say, I'm really sad. This is a really missing piece of our relationship. And actually with a prescription medication, I saw her 3 months later and she was having pain-free intercourse. So it is treatable, it is reversible. But without treatment or some kind of maintenance, it is what we would call chronic and progressive. So what happens often in my practice is we find a treatment plan, it works, sex is now comfortable, and women think, what, maybe I don't need this anymore. And not surprising, 3 to 6 months later, maybe 2 years later, the pain is back and they're back in that cycle. So I tell women, once we find a solution that, as long as you want to have sex comfortably, you're going to need to do some maintenance. And many of our products are very low dose. And so even missed dosing can lead to less than optimal outcomes. So my other message to women is if you're not compliant with your prescription, if you're using it even 80% of the time, it's probably not going to be as effective as it could be. So it is something that unfortunately just requires ongoing attention. And it's so easy, again, for so many years it didn't require any of our attention. And we didn't know that much about it or how to attend to it, so to speak. So again, I'm glad we're having this conversation so women can be more informed and hopefully be more comfortable in engaging in sex, because we have enough obstacles with maybe sleep disruption, and most women are not loving their body changes and what's going on. So libido is affected by a number of negative factors. So we want to make it possible and comfortable whenever possible.
Yes, thank you so much. It's great to know that there are answers, but again, we are responsible to take responsibility for our health, use our prescriptions as directed, and to get those prescriptions, we have to talk to our doctors. But speaking of prescriptions, I'm certainly with Kelly in Nebraska when she is asking, why is there not a Viagra for women? I mean, anything would help. I read somewhere this is because women are harder to figure out. So why is there not more being done? Now, Allie, does this seem out of whack to you?
Yes, it's very out of whack. Matter of fact, my husband, you know, when that commercial comes on TV, he says, he always nudges me and says, you need to talk to your doctor. There's got to be something for women. There's got to be some type of Viagra for women. And of course, I Google it and I get on online and I'm like, nope, there's nothing. I don't believe there's anything. And so it's not that I've lost it totally, but it does take me longer to get in the mood. But one thing I do have to say is my husband is very understanding. And, you know, when you've been together over 30 years, you can talk about anything. And I think a lot of women that I talk to are not that comfortable with their spouses. They can't talk to them like I can talk to my husband. But why isn't there a Viagra for women? And is there one maybe in the making?
So, Dr. Barb, you would know about this. Can we look forward to Viagra for women?
There's a really great question that I hope before long we'll have a solution to offer our patients. It's a complicated area that is under a lot of discussion. There are camps on every side of this issue. One camp says this is physiologic, it's natural, it's normal to lose desire. Why are we trying to medicalize it? And why is pharmacy trying to benefit from it? And then there's another camp that says, but it's an important part of my relationship and I really want to try to make it better. So isn't there something we can do to do that? So right now in the United States, we have prescription options to treat vulvovaginal atrophy, the things I referred to earlier, and as they relate to pain with intercourse. But to talk about libido and what's going on in our brains, we don't have anything to address that. Admittedly, libido for women is pretty complicated. There are multiple hormones, there are neurotransmitters involved, you know, not to mention some of the blood flow and so on. So to say there's a drug for that, I'm hoping someday there will be. We do, as clinicians, use a couple of medications off-label for that with some limited response. I was in Washington, D.C. in October, just 5 months ago, at an FDA hearing about this topic and talking about the process that medications are trying to go through to seek approval. A number of medications have gone through clinical trials. We're feeling pretty good about their safety. The FDA hasn't been completely comfortable with their efficacy, so to date they have not approved it. There is one that's undergoing an appeal. We're hoping to get an answer by late summer. And if it is approved, I think you and millions of other women will be hearing about it and at least willing to consider trying it. I'm not sure we're going to find a great drug that's going to work for every woman in every situation, but even if we can improve it somewhat in many situations, that would be a home run for women's health.
Absolutely. It would certainly be a home run.
Yes.
And I think this event has been a home run because we've covered so much territory and I've had so many of my questions answered. And I hope that that's true for everyone who's tuned in with us. We have one last door prize, another $100 gift certificate to Soma. And I'm happy to announce that that is going to Sharon. So Sharon, again, please watch your email for something from Vibrant Nation and we'll let you know how to claim your prize. And for the rest of you who tuned in with us today, we are going to send out a quick survey to ask you what you thought of the event and what might make future events better. So please answer that if you have the time. And once again, we want to thank our sponsor, Pfizer, for making this conversation available to everyone, and we couldn't have done it without their support. And we'd like to thank our panelists, Allie Smith, Lisa Copeland, Rebecca Forstott-Olkowski, and of course we'd like to thank Dr. Barb, who brought great medical advice and helping us out today with answering everyone's questions. So we will be featuring some short segments from this event on vibrantnation.com. So we look forward to passing those on to you, and so that you can pass them on to your friends who might be having some of these same issues. And in the meantime, we'd just like to remind you to talk to your doctor. You're worth it. Your sex life is worth it. So find the courage, go on in there, and talk about it. There are medical options out there that can help you have a great sex life during and after menopause, so go for it. So keep doing it, and thanks for tuning in.